insulin resistance is something that comes on slowly, and it's caused by eating too much sugar or drinking too much ethanol, because both fructose, which is half of every sugar molecule, table sugar molecule, and ethanol are processed through the same pathways in the liver, and 80% of the calories from those things wind up as fat in the liver and fat in the pancreas. And that causes insulin resistance, where the insulin stops working. Once you're insulin resistant, you can't tolerate carbohydrates in your diet any longer, and you're just going to get fat. And everybody has a personal fat threshold, so 10% of all diabetics have a normal body mass index, but and they can't put on that fat, so that fat just builds up in the internal organs. That makes the insulin resistance worse, and high insulin levels and high sugar levels do the damage. Having high insulin levels and high sugar levels, and that's cancer, blindness, stroke, heart disease, heart failure, peripheral artery disease, gout, polycystic ovarian syndrome, non-alcoholic fatty liver disease, osteoarthritis, Alzheimer's disease, Parkinson's disease, amputations, kidney failure, sleep apnea, hearing loss, psoriasis, low sperm count, low testosterone, erectile dysfunction, fibroid tumors, enlarged prostate, glaucoma, early onset sexual maturity in children, clots, especially deep venous thrombosis, and pulmonary embolisms, gallstones, sarcoidosis, carpal tunnel syndrome. On my website, you'll find links to the scholarly articles that implicate the metabolic syndrome in all those conditions. And Doug McGuff, MD, he's an emergency room physician that also has run a gym for 35 years where they train people. And he wrote a book called Body by Science, where he shows that the secret to using exercise to lose weight and to fight insulin resistance is to exercise the muscles to exhaustion over 60 to 90 seconds. And it's fairly complicated, the science behind it, but there are basically 4 types of muscle, and the strongest fast twitch fibers that we only use when we're totally, all the other fibers, the first 3 levels of fibers have been exhausted, and they're the ones that use almost exclusively glycogen. So to get rid of the glycogen in our muscles so that the muscles become insulin sensitive again, we have to trip those fast twitch muscles, and you can only do that when you exercise the muscle to exhaustion. The science behind it, all the studies are cited in Dr. McGuff's books, Body by Science. So I highly commend that to anybody who wants to exercise.
This is what the guys like Stu Phillips and some of these protein synthesis and muscle researchers find, that, when you talk to them, the biggest stimulus for, muscle retention is training, pushing the muscle to fatigue, to full fatigue, to failure or near failure is what you want to do. Now, some exercises don't lend themselves to failure. You don't want to put a barbell squat on your back and go to failure because you're going to end up getting hurt. But I mean, there's machines that allow you to do that, and there's different things that do that. So that is an important point. I think, the value of exercise is not so much can I lose 20 pounds, but can I get stronger? Can I improve my cardiovascular conditioning and all the other things that it helps. I mean, it's, the muscle is not just, moving your biceps. It has a lot of metabolic impact on the body as well, as we're learning.
So we're supposed to practice evidence-based medicine, but what I find most of my colleagues practicing is what I'd like to call expert opinion medicine. Okay, so they take the expert opinion of FDA advisory panel, and they say that's gospel. And we all know that that's very flawed science. In fact, they've excluded any evidence pretty much that could support low carbohydrate diets from their consideration. There are more and more doctors finding low carb. I'm in a group of about 200 doctors that we communicate by email in a Google group, and we talk about the latest research in low carb. And I'm also a member of the Association of Metabolic Healthcare Practitioners. It was really started by Low Carb USA. Low carbohydrate medicine is gaining in respectability and prominence around the country, but I'd say it's exploding with, the Verta program now is available in the VA. It's a low carb program. United Healthcare, which has something, they insure something like 24 million Americans for their health, has started a kind of a copycat program of Virta called Level 2. Virta published a paper showing that when people went on their low-carb diet, the insurance companies could save $10,000 a year in medication costs alone. 90% of them got off all their insulin and other medicines except for metformin, which is very, very inexpensive. And they have their A1Cs drop below 6.5, which is the cutoff for diabetes. The insurance companies are very interested because they're beginning to realize that they can save a whole lot of money if they can get people to go on low carbohydrate diets. One of the approaches that the Level 2 that's sponsored by United Health Insurance, that they're giving their participants in that program continuous glucose monitors to use. And they tell them to be particularly aware of what the levels are an hour or two after they eat, because that can teach them which foods that they're eating are raising their blood sugar. And so it's a great educational tool. I like to use it myself in my patients if they're having trouble on their low carb diets and not getting the weight loss they want, or the lowering of their hemoglobin A1C number, the number that represents how your blood sugars have been over the last 90 days. If they're not getting enough progress on that, then I will often prescribe them a continuous glucose monitor and tell them just to take a picture of everything they're eating. And so that after the 2 weeks when they get their report, they can look at the spikes and then go back and look at the pictures on their camera and find out what foods were raising their sugars.